Lupus. Whoever has lupus, I want you to understand that you are not the cause of it and you didn't bring this upon yourself and you are not weak. Okay, it's very important. Lupus is an autoimmune disease where the body fights and attacks against itself. We have different types of lupus. We have the systemic lupus erythematosus, or the SLE. This one loves your organs in your body, like your kidney, like your lungs, like your heart, everywhere, even on your skin. It just loves every organ in your body. We also have the cutaneous. Cutaneous strictly loves only your skin, only. Causes skin lesions, causes butterfly rash, where people sometimes mistake it for rosacea, or sometimes people mistake it for Lyme disease. It causes all of that. We strictly also have the drug-induced lupus. The drug-induced lupus, how it happens is medications like isoniazid, medications like hydralazine. These medications can induce lupus. It can bring lupus. People go through a lot of stress just by taking that medication, bringing unnecessary lupus. But once they stop taking the medications, it gets better. You want to see your doctor, and you want to really talk to your doctor very well. Number 4, we have the neonatal lupus, where the autoantibody from the mother is being transferred to the baby. So guess what? Then the baby is also having lupus. But as the baby is getting older, the lupus gets better. Okay. We also have other symptoms. Symptoms like thin hair that comes with lupus or alopecia. We also have muscle or weight loss, muscle pain, arthritis. Muscle pain is different. Arthritis is really affecting your joints and inflaming the whole joint. Okay. We also have pleuritic chest pain, where people go to something called sinusitis. Pleuritic chest pain, sinusitis, is going to be inflamed and filled with unnecessary fluid all over your lungs. African Americans also tend to have lupus more than many other races, unfortunately. Okay, we also have foamy urine from less kidney function. It's very important. People also go through psychosis or confusion from lupus. All right. We still don't know the real causes of lupus, but clinically, scientifically, research has found that genetic factors can cause lupus. It's very important. Hormonal factors as well. Hormonal factors, females have more hormones than us men. So sadly, women go through lupus more than us men. Reactivated viruses like herpes, like a lot of people who even have strep throat, it could flare up lupus. The herpes simplex virus, those viruses going dormant can make your lupus relax. But once those viruses are flaring up, then guess what? Your lupus is also flaring up. Okay, sleep can flare up lupus. Food allergies can flare up lupus. Okay, insulin resistance can flare up lupus. It's very important to know, all right? We have a lot of labs. Okay, we have anti-nuclear antibody tests. We also have the CBC, that's the complete blood count. We have the ESR, that is the erythrocyte sedimentation rate. All right, we have the skin biopsy from the cutaneous one I was talking about that loves your skin. Once those lesions happen, the doctor can do skin biopsy strictly from the skin lesions or the NC. All right, able to call that one skin biopsy test. We have C-reactive protein tests. It's very important, okay? Let's pay attention to all of these labs that I've told you about. We also have a very major important lab. We call it ANA. ANA, you want to tell your doctor to rerun those labs and see. Okay. Now let's talk about some treatment for lupus. We still do not know the real major treatment for it, but we can talk about management where we will not flare up, where we wouldn't also have great management. We will also be able to maintain and manage these symptoms. It's very important because lupus can cause organ damage. So we need to find some managing ways to be able to manage the risk to damage any organ in our body. It's very, very important. You need to stay away from sunshine. Okay, you need to get some healthy lifestyle going on. Okay. In the process, your doctor is going to put you on some medications like NSAIDs and then also like low dose steroids. Now, these ones happen when the lupus is not severe. Okay, they put you on some NSAIDs, they put you on some low dose steroids. As it's getting worse, the doctor is going to put you on some immunosuppressants like methotrexate and some strong steroid medications. Okay, it's very, very, very important. Now, remember this. These same immunosuppressants can cause infections because it has immunosuppressed your system so much. In the process of suppressing your system, your body is now prone to infections. Okay. Steroids. These steroids, either the low dose or either the high dose steroid, can cause something called osteoporosis. Okay, it's very, very important. Lupus itself can cause myocardial infarction. Lupus itself can cause stroke. Let's pay attention to these things. And lupus itself can cause kidney or lupus nephritis. When you have lupus, you want to see your doctor. When you have lupus, you need to take very good care of your health. You need to stay away from a lot of sunshine, a lot of heat, because heat activates those viruses like herpes simplex virus. They love heat. Once they get a lot of heat, they start activating. Once they start activating, it will cause these reactive viruses. These reactive viruses will react and activate and start flaring up your lupus. It's very important. Pay attention to this. Okay, and then I need you to share it to somebody who has lupus or somebody who has family history of lupus. They need to understand the labs, the types of lupus, from the SLE all the way to cutaneous, all the way to drug-induced, all the way to neonatal lupus. They also need to know the lab tests. It's very important. Okay, my name is Nurse Solomon, and I'll see you.